cylinders. Why are they? What are they?
And for this new machine, maybe just to
Yes.
cut it short, we have the delivery notes. I think is also important.
Yes.
That is annexure 21H, copy
Yes.
of the delivery notes, and annexure 21I is a copy of the picture of the PCR machine.
What was the value for the machine?
I may not be able to say that.
Good.
Yeah.
But was there value for money?
Yes, definitely.
Okay. Annexure 21J. What are those cylinders?
21J.
It appears in this form.
Yes, that is
Yes.
oxygen manifold system.
Yes.
At the start of the outbreak, first of all, we in March 2020, I think when we had the first case in Kenya was 13th March 2020, if I can remember. We were able to set up an isolation ward, which we didn't have before. We also set up an ICU that we've never had since independence. We have an 8-bed capacity ICU, and initially we were using oxygen cylinders bedside, but that's a bit crude. So we were able to advise the relevant officers so as we can move to the oxygen manifold system, which is it's actually a system you've seen.
Yes.
Yes, so it's connected the 8 oxygen cylinders, 8 medical air.
Yes.
And there's piping.
Okay.
to
But
the
they
ICU.
are available in Wajir.
Yes, we have.
The witness who was testifying on behalf of the county assembly indicated that the state of health in Wajir cannot be compared to the times of independence. What's your statement? Is there a comparison between independence and 2021?
Definitely. At independence, we only had one operational theater in a county the size of 56,000 square kilometers.
Yes.
Meaning someone will be referred over 300, 400 kilometers for a basic cesarean section.
Yes.
But now we have 4 comprehensive emergency obstetric and neonatal care facilities that can be able to do cesarean sections.
Courtesy of Governor.
Your time is up, I'm told.
This is courtesy, of course, of the first regime and also the second regime.
Finally, talk about the general delivery of services and whether citizens of Wajir are compelled to pay for ambulance fuels and buy the spares for the fuel.
Yes. For that one, I am not aware of anything like that. Nothing has come to our attention on that issue. Because what I know is the ambulance services are free. We normally make, as a technical head in the department, I'm actually involved in the preparing of the budgets and the annual work plans. And we've sufficiently put in enough budget of about 25 million for the referral system. And there's an annex I've just shown.
Yes.
21A.
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 Yes.
As you can see,
Summary of referrals.
summary of referrals.
Yes.
This is the source is the Wajir County referral registers that we used.
Yes.
And in terms of the costing, we use the number of DSA allowance that the driver will get in terms of referral, the number of days they'll spend.
Yes.
Fuel, we looked at the mileage of the ambulances
Yes.
so that we get the exact figures.
Yes.
So as you can see, I'll just save time.
Correct.
If you look at it, the total comes to 45 million.
Yes.
In that,
379,400.
379,400.
Yes.
And this is the data for the financial year 2019-20, where there was the alleged issue of people paying for ambulances.
Yes.
And we had budgeted for 25 million, and we noticed that the amount went a bit higher. But what we did, the referral unit actually shares some cost centers with general administration.
Yeah. So
Things
this.
like fuel and
So this amount expended on these referrals, is it indicative of how operational the referral facility is?
Yes.
Does it indicate to a failed and a collapsed health system?
No.
Is there anything else that you'd want to add before I yield you to Senior Counsel Ahmed?
Probably the other thing I need to add, before devolution, we actually, I don't know if it's the right word to use, we inherited
Yes.
about 11 ambulances.
Yes.
The county government, the first county government, procured 8 ambulances,
Yes.
and the current regime also procured 3 ambulances,
Yes.
and we got 1, which is a donation
Yes.
from IGAD. But still, because of the poor road network and the vastness of the county, we have frequent breakdowns. Yes. Just wanted you to note that.
Okay. Witness will be cross-examined
Yes.
by my senior learned friend, Mr. Ahmed.
Okay, thank you, Senior Counsel Ahmed Nasir.
Yes, Chairman, thank you very much. Dr. Somo,
Yes.
I will start where we just left. You say, first, you told that the budget, the annual medical budget is about 2.4 billion.
Yes.
That is fairly impressive, isn't it?
Yes.
To have a budget of 2.4 billion.
Yes.
Yes. Now, and you said the population of Wajir is about 769,000.
Yes.
And the country is vast.
Yes.
I mean, up to near Masabet.
Yes.
And this
Ethiopia.
side Somalia, Ethiopia.
Yes.
And it's your evidence that during the last 4 years, if we calculate the budget of health is about 9.6 billion shillings. Yes.
The last?
Since this government came to power,
You said 4 years.
Governor Mohammed Mahmoud,
Okay. Okay.
it's about 9.6 billion. Eh?
Yes.
And you want to tell us that with a budget of 9.6 billion, such a vast county like Garissa, or Wajir, I'm sorry, with a population of 700, you bought 3 ambulances. Just 3 ambulances.
Yes, we bought 3 ambulances, but good quality ambulances.
We'll go to the quality.
Yes.
But 3 ambulances of a budget of 9.6 billion.
But what is the budget of health? I think you said 2.4.
Listen
We
to
also
me.
have other competing priorities.
So let's move on.
Yeah.
You bought 3 ambulances.
Yes.
How many of those, you said there was 3 ambulances by this, the previous government had 8, and then you inherited 11 from the national
The national
government
government.
in 2010.
Yes.
Obviously, those are not working.
They're
surely.
not working.
Yes. So, how
Not all
many-
of them. Some are working.
Listen,
Yeah.
how many ambulances are functional that you can send from Wajir and pick a patient in Bute? Or the border at Horofarar?
About 14 ambulances.
How do you have 14? Count for me. You had 8 by the previous governor, 3 by now. That's 11.
We
You
said
have, you have about 11.
no.
Uh,
We said 8 by the previous regime,
uh,
3 by this regime. That's 11.
yes,
Plus 1 from IGAD. That is 12.
yes.
And from the national government, we still
So
have 2.
assume on a given day
Yes.
you have 20 emergencies.
Yes.
1 in Kutulo,
Yes.
1 in Habaswene,
Yes.
1 in Modogashe,
Yes.
1 in Bute,
Yes.
and 15 others somewhere else.
Yes.
How will you prioritize whom you will send it?
God forbid that happens.
It happens every day.
It doesn't happen. God forbid, don't pray for us. But in case that happens, we've done zoning of the ambulances so that one ambulance at a specific area can respond to an a case in another
When an
sub-county.
ambulance leaves Wajir, it goes to Bute. How many hours does it take on
Yeah.
that rough road?
We already have an ambulance at Bute,
Yes,
stationed at Bute.
yes.
Yes.
And Kutulo?
Kutulo, we have one at Kutulo and one at Tarbaj. Yes.
So how many do you have in Habaswene and Modogashe? And
Ambassador,
Banane?
we also have one. We have one at Sabuli.
Yeah.
We have one at Diff,
You have,
because Wajir South is close to half
you
of
have distributed, it means you have nothing in Wajir town.
We have in Wajir town 2 functional ambulances we've put in Wajir town.
Now let me
But-
ask you, let
yeah.
me ask you, look at 21C,
21?
21C, this just. Are you there?
Yes, I'm here.
Now I can see also from your job employment, you joined it 2016.
Yes.
So you're also in Governor Jir's government, eh?
Actually joined in 2012, Wajir.
12, eh?
Yeah.
So during that time,
During the national government.
let's just do a devolution, eh?
Yes.
You are there now for about 10 years.
Yes.
8 to 9 years of devolution.
10 years.
Yes.
Okay, okay.
You have a budget, if we say a budget of about 20 billion.
Yes.
You have spent 20 billion on health. Estimate roughly, we are 9.6 in this government, another 9.6 in the other government.
No.
How much?
The first budget I remember was 1.4 billion,
Yes,
and we are increasing
gradually.
gradually. So I can't say that figure.
Let's just take an average of 1.5 times 5. That's 7.5 plus 9. That's 15 billion, eh?
Yes.
During your time, eh?
Yes.
Look at the chart on page 21C.
Yes.
With a budget of about 16 billion,
Yes.
you have added one scan,
Yes.
you have added one intensive care unit,
Yes.
you have added one renal unit that doesn't work, I'm told.
Yes.
You have 30 laboratories.
Yes.
You have added one radiologist unit,
Yes.
and you have 4 theaters. Just 4 theaters in a county as big as Wajir.
Yes.
Haven't you slept on the job? Unsoundly, if I put it.
We have done another theatre in Eldas. We are just waiting to post a medical officer. There's another theatre in Eldas, which has been done by the county.
How do you justify a budget of 15 billion?
But you have not talked about the salaries that you are paying.
15 billion. And
15
you are here telling us that you have added one renal unit, you have added one theater, you have added this.
But,
A budget of
but
that
15 billion, almost 8 billion goes to salary.
Where do you take all this money?
And
if I
also
ask you?
other recurrent is also there.
Huh?
I'm not an economist, but if you pay salaries that amount,
Let us come
I
back
think
to
that's a huge investment in terms of human resource.
let us come back to these hospitals. You said you have 122, but you have 42 that are not operational.
Yes.
So you just have the buildings. That's what you're saying. You have
Yes,
the buildings.
Yes.
You just need the machines and the
Yes.
and
And the human resource.
human resources.
Human resource.
Yes. Now, every logical person will ask you, why do you build 42 units or 42? What do you call them? Health facilities. You build 42 health facilities at X cost, and then it's not operational at X year. Isn't it a way of making money so that money is spent?
Actually, most of these projects are ward-based projects.
Just answer my question. Why do you build 42 units at X cost, leave them unoperational at Y year, and lose all that money?
Maybe through the chair, as I said, this is a vast county, and building all those facilities is actually a good thing. But in terms of recruitment of human resource, the wage bill is also ballooning. But
Let me take you to this COVID. Eh?
yes,
You said you are trailblazers, but it broke down.
we had
You said you are trailblazers, and you are one of the first counties
yes,
to have it.
yes,
But the machine broke down.
yes.
Up to today, it's not working. Isn't it?
You could not get the spare part in Kenya.
Answer my question. Up to today, it is not working.
Yes, it
So-
is not working, but
yes.
you have a new machine.
And when will that machine be operationalized?
We are waiting.
God
for-
willing. God willing.
God willing.
Yeah.
It's not the only county that got through this project.
Just answer my
What
question.
I'm aware is that they're coming end of May, a team from Ministry of Health, and the supplier to come and do the training, end of May. So by 2nd June, inshallah, I think you can come visit Wajir
and test myself.
and test yourself.
Now let me ask you, who is your deputy director?
I have 3 deputy directors.
Yes.
Yes.
I mean, there's one called Dr. Adan.
Yes.
He has his own hospital.
Yes.
What does he do for you? Does he supply you oxygen?
I am not aware of that.
How can you not be aware? You are in charge of health. How can you not be aware?
I'm not aware of that.
Do you have oxygen in Wajir? Or is your plant that makes oxygen inoperational?
The plant is non-functional.
You get some from Elwak in Mandera, isn't it?
And also Nairobi.
Just answer. Do you get from Elwak?
Yes.
And the rest you get from
Nairobi.
Dr. Adan's Ladran Hospital, isn't it?
No. I'm not aware of that.
How can you be not aware?
The hostel also has a CEO
Yes.
who's an accounting officer also, and we have also the chief officer. So I cannot know who has been awarded what in bringing oxygen. What I just know is that there's oxygen.
Isn't Wajir a place where doctors do business with your hospitals?
I'm not aware of that.
You are not aware of so
Yes.
many things, isn't it?
I'm under oath, so I have to speak the truth.
Why is the renal unit in your main hospital not working?
It is functional.
Why is it not working, I said?
It is working.
So the renal unit is fully functional.
Yes,
And-
as far as I'm concerned, we have 6 dialysis machines that are working. There was
How many are not working?
we only have 6.
So all of them are working.
All of them are working.
So the renal unit is fully operational.
They're all working,
Yeah.
but there's one challenge that happens.
Yes.
These machines were under the MES Managed Equipment Services
Yes.
program, their list, and the salty water that is in Wajir normally destroys the membranes, and the company that supplied this is called Angelica under the MES project, and they have replaced that membrane close to 8 times, and each membrane is 150,000. So they told us we cannot pay for it anymore, and currently now we have to do it ourselves. And in terms of this financial year, we've put a desalination machine so as to help us in that saline water.
Finally, as I conclude, how many doctors do you have in Garissa, in Wajir?
Wajir, we have
Doctors, I'm not talking of clinical doctors, I'm talking of
Medical
doctors. Yes, medical
officers.
doctors, yes.
we have
Bachelor of Medicine, Bachelor of Surgery.
we have 50,
50.
24 and study leave.
So you have 26.
26, yes.
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 And you pay for those who are on study leave?
Yes, we pay for them.
Yeah.
And I think there's an annex which I attached,
Yes, I've seen it.
whereby we talk about the doctors.
Yes.
And you need to know that we only, before the advent of devolution, we didn't have a single consultant. We did advertisements, we could not attract anyone to Wajir.
You have one
So-
Ethiopian, I'm told.
So we said we are going to do a long-term investment by sending the doctors. And once they come back, this will actually help us. It will reduce referrals. It will reduce maternal complications. And yeah, because you can see in the annexure,
Now, out of these 26 you have, how many are surgeons?
let me come to the annexure. It's 21B.
Yes, how many are surgeons out of this?
First of all, we already have one surgeon who has come back. Dr. Jamal Abade has come back.
Just answer me, how many surgeons do you have in Wajir County?
Currently, we have 2 surgeons. The ones still on study leave are another 2 surgeons.
So you have 2 surgeons.
Yes.
Where are they based?
We have 2 surgeons based at the county referral hospital.
In Wajir.
Yes.
So if someone wants a surgery in Modogashe, what happens?
Actually, according to the health standards and
Just
the Ministry of
me.
Health,
Answer me. What happens?
a level 4 hospital should have 18 consultants. We only have 2.
I'm saying, what happens if you have a patient in Modogashe who wants surgery, urgent surgery?
The medical officers will review.
Yes.
If there are cases that they can handle,
Yes.
they will handle, because they can also do surgery. If not, the patient will be referred
To Wajir.
to Wajir, yes.
Okay.
And the reason we've sent people on study leave is to make sure that we have consultants across all the sub-counties.
Thank you very much, Chairman. I have no further questions for that. Thank you very much, Doctor.
Okay, thank you.
Just a short
It cannot be short. Make it 2 minutes.
Yes. Dr. Ray, kindly confirm whether or not all the monies allocated for health has been put in good use.
Can I?
Confirm that the money allocated for health has been put in good use.
I think so. I'm not an accounting officer.
saying-
but
You have value for money.
yes, I have value for money. Yes,
Good.
there's value for money. Yes.
Confirm that the unique circumstances under which Wajir County fights itself, security or insecurity included, has largely affected performance across the entire region. Yes?
Yes, it has.
And that Wajir is not unique to the situation.
Yes.
This is Dr. Arden. Yes?
Yes.
Do you know whether he supplies anything to the hospital?
To be honest, I'm not aware of that.
Yes.
But
Has there any evidence that has been tendered that he contributes or rather supplies?
nothing has reached my office.
Yes.
I'm not aware of that, but we can follow up. Maybe the chief officer and the CEO
You
can
say
follow up on
that-
that, but I don't know that.
There's a problem of workforce because of the challenges Wajir faces.
Yes.
And that is a challenge that is unique to the county
Yes.
to an extent that you have to cater for the doctor's study leaves.
Yes.
Would in ordinary circumstances, would Nairobi find itself in such kind of circumstances?
No. Because once they advertise, a lot of people will apply.
The Mogadashe issue. Kindly confirm whether you have put into place mechanisms of mitigating the suffering of the people.
Modogashe is in Garissa County, not
Okay.
Wajir.
Finally, the 42 unoperational hospitals. Is there a population domiciled in that area?
Yes.
Do they require the facility?
Yes, they do require.
What has affected the workforce?
As
You
I
say
say,
insecurity, correct?
yes, insecurity, high staff attrition,
Yes.
transfers,
Yes.
desertions,
Yes.
we have all that.
Do you attribute that to the governor?
No.
Good. Daktari, and you'll be sought for clarifications.
Okay,
And
thank you.
you're
Thank you,
grateful.
Council. Very well. Honorable Senators, anybody wants to seek any clarification? Senator Kiyika Susan.
Oh, thank you, Chair. I think there is a machine you referred to. I'm not sure if you called it the PCR machine.
Yes.
And you said it still has not been installed or you're waiting to train people.
Yes.
And it's one of the machines that helps to test for, say, the COVID virus.
Yes.
And at the moment, you don't have capacity waiting on this machine.
Yeah. There's
What
no
are you doing at the moment as you wait on this machine?
We are sending specimens to National Public Health Laboratory, and we get the results within 24 hours.
And those are the ones you're saying you're airlifting or something like that?
Yes, the ones we airlift.
Wouldn't it make more sense for the county government to move with speed as far as installing this machine, training the necessary staff, so that you shouldn't even be waiting to launch, or I don't know what word you called it,
Yes.
but make it a priority so that maybe in the next week or two something is happening as far as that? It just seems to make sense in the middle of
Actually,
a
I've been
pandemic.
making follow-ups,
Okay.
and currently the team that was doing installation, Last week was in Kwale. And they're going to another county this week. So they're actually really working hard. But I'm pushing them, and they assured me by the last week of May, they're going to do it.
Great.
And that's why I said by June 2nd, but it could even be earlier.
Okay.
Yes.
That would make sense given we have a pandemic that can't wait.
Yes.
Now, very quickly, I think it was 21B, or is it a 6? It's a B, I imagine. The one where you have the names of, I assume, doctors, and then where they're studying, the courses.
Yes, 21B, yes.
Okay. So I was just curious, how many doctors do you have in the, employed by the county government of Wajir? Like, would you know?
50 doctors.
About 50.
Yes.
But now when I look at this 21B, I see you have 22 who are on study leave. Is that right?
Yes.
And these 22 are out or are a part of the 50.
Yes, they are part of the 50.
Now, doesn't that seem a bit, I mean, granted, we want people to enhance and get better education and specialize and all that. But doesn't that seem very poor management of human resource? I mean, if half of the doctor population is away studying, you're paying salaries, I'm imagining.
Yes, you're paying salaries.
What is the, what kind of, I mean, okay, let's back up a bit. So assume I'm a doctor and I work
Yes.
for you in Wajir County.
Yes.
And I want to join University of Nairobi and become a specialist in whatever.
Yes.
So do you just approve that, or do you have steps where maybe I have to wait for some to come back, or do you release some people, hire others as they go study and come back? Or what kind of, or are they protected in a way that you have to give it to them and keep their slot? I'm just wondering, because 22 is a very big number out of 50 in a population of 700,000.
Actually, we did a training needs assessment before we started sending people on study leave, and our priority was to have at least 2 specialities, as in each specialty at least to have 2 consultants, and we had nothing.
Okay.
Chair, we had 0 consultants. Actually, the first consultants in the first government, we could not attract anyone. We sent people on study leave. So we actually even had to get a doctor from Ethiopia on contract. We gave him a work permit through all the procedures that were followed. The board approved. We were that desperate. So for us sending, actually the last financial year we sent 3. And the reason we sent those 3, because we didn't have female consultants. All the 3 were actually female. And there are people who are going to do gynecology, and most of our women prefer to be attended to by a fellow woman.
Makes
so
sense.
that's the reason we did.
Okay.
But actually right now we want to put a stop to it until we get most of them back. And this year we expect, I think I've written duration of study, if you can
Yeah,
see.
yeah.
You can see most of them are actually coming back.
And finally, on that one question, so when they, do you have a contract where they sign so that if you pay for their study leave, then they have to come back, or do some finish and then go to greener pastures?
Through the chair, we have bonded all of them through the magistrate court in Wajir, and they have been bonded the duration of their study.
Okay,
If it is a 5-year course, will be bonded for 5 years.
okay,
Yes.
perfect.
Okay, well, thank you. Senator Petronila Were.
Thank you, Chair. You've been the County Director of Medical Services for the last 10 years?
No.
Since before the advent of devolution?
I was confirmed in 2016.
Okay. So you've also told us that the health docket takes the highest chunk of the budget?
Yes.
Okay, rightly so. And health really was the selling point for devolution. So we have no problem with it taking the highest share. What I want to know is, how have you ring-fenced the health funds from abuse, from misappropriation as the Director of Health Services? How are those funds protected from abuse? Secondly, has the county suffered any challenge, for example, the challenge of electricity, to connect machines or equipment, like that equipment provided in the medical equipment scheme? So have you suffered any challenge of that nature? Thank you.
Okay. Thank you. Through the chair, the first question on ring fencing, I think this is actually a challenge in all the 47 counties, and probably can only be solved through legislation, because you have a big challenge. Everything goes to CRF, and they're always competing priorities. But for us doctors, health is the most important thing. So that one, maybe through the legislation, I will humbly request the committee members maybe to also, as you're also fighting for devolution, I think that is one thing. Probably if you do that, you'll leave a legacy. The second one was on the issue of the managed equipment services, the leased equipment. It is true we're having a challenge. This hospital has a transformer of 250 kVA. The power consumption is 600 kVA. So at the moment, our CT scan is not functioning. We have gotten advice from KPLC to buy a larger capacity transformer, which the county has done. We have bought 1000 kVA transformer. We were also advised to construct a transformer house for that transformer, and this transformer is a dedicated transformer just for the hospital. The 250 kVA is outside the hospital, meaning we're also sharing with other residentials and other buildings. But this 1000 kVA will be dedicated to the hospital, and it can also be used for future expansion. So currently what is remaining is a control panel. We're also told to do a control panel. Once that is done, KPLC will come and install. So at the moment we've reached the stage of the transformer house. So I think probably if the budget is passed, I think that is one of the priorities we've identified. Even the oxygen plant is not functioning because of the power issue. So once that is sorted, I think things will be good. Thank you very much.
Thank you, Senator Kavendu. Madama.
Yes, Chair, thank you for this opportunity. Just a clarification. This machine that you said that it broke down and there's no spare part in the country, and you've ordered a new one, isn't it also possible to order for a spare part from outside? We have many cars and many machines here without spare parts in the country, but people request for them from outside. Don't you think ordering for that spare part and then having both machines will help Wajir County better?
Yes. Actually, through the chair, once we could not fix the machine, we got communication from Ministry of Health that we are getting this new machine. So once we reach that level, we just said it will be more economical to wait for that machine that is coming, and meanwhile continue sending samples. And of course it's at our cost, the county's costs, sending the samples. We do specimen referral, and if you look at the guidelines sent by the Ministry of Health, you'll see that only around 35 facilities are down that are conducting tests, meaning the rest are actually sending samples. And the reason why we're actually lucky is our laboratory is one of the World Bank projects, East African Public Health Laboratory Network, which was done by World Bank. We had 5 labs, similar labs: Machakos, Wajir, Malindi, Kitale, and Busia. So our lab is actually ISO certified.